Hey everyone, are you having just some generalized wrist pain? You've not been diagnosed with necessarily carpal tunnel syndrome or other conditions of the wrist, just generalized soreness or pain in the wrist, and you've been cleared by your doctor to perform some exercises or treatments at home. I'm going to show you 3 easy tips that you can do to try to improve your range of motion and try to help that pain as well as improving the grip and strength in your hand. The first thing we're going to do is we're going to use one of these little myofascial release balls or soft tissue release balls, whatever you want to call them. These are really, really neat. I use these for a lot of different things, and they're fairly inexpensive. They kind of come in a pack of, I believe it's 5. So what I'm going to do is I'm going to go on the wrist flexor mass, so this section right here. Because most commonly a lot of your wrist pain is pain on the volar side or this kind of front side of the wrist. Now you can have pain on the back side as well. So a lot of these treatments you can use for both of those conditions or both of those areas. So you're going to take this ball here. I'm going to put it right on this flexor mass, right here. And then I'm going to take my wrist and pull it back. I'm going to take my other hand and pull my wrist back, and I'm going to stretch. At the same time, I have this myofascial ball or soft tissue ball or whatever you want to call them, acupressure ball, in that muscle mass, and I'm just holding that stretch. And I'm going to hold that stretch between 30 to 60 seconds if I can. Just pulling back as far as I can. Not really aggressive. You don't have to be super aggressive with pulling your wrist back. You don't want to increase any irritation on ligaments or tendons that are running through here. But you're just going to do that and hold that in that position, 1 to 2 times a day. Now, if you're having pain on the back side of the wrist, you can also do this on the back side. Take that same ball, you're going to put it in this area, so the extensor mass over here, it's a little difficult to get to, but kind of do the best you can. And then in that position, you're going to pull the wrist and hand down towards you like that. And you would hold it in the same position and hold that 30 to 60 seconds. And just do it the same way. Now we're going to do grip strengthening. You can get these online if you go to my Amazon products, my favorite Amazon products, my website, ChadGOrthoOT.com. You'll see a link to these here. I actually like these. Number one, I like the color because it's my favorite color. And just general grip strengthening. So you're just going to grab this and then work it somewhere between maybe 2 sets, 10 to 15 repetitions. So, and set the resistance. These are adjustable with the resistance. And you're just going to set that to where, you get to 10 reps, 9, 10 reps, it starts to get pretty difficult. You feel a little burn there. And then you're going to do that for a couple of sets, maybe once a day. The last movement that we're going to do is going to be dumbbell exercises here, both for the wrist extensors and the wrist flexors. So the extensors pull the wrist back like this, and the flexors pull the wrist down this way. So I'm going to hold it here, and I'm going to pull back into extension. Now, initially when I first started practicing, I would tell patients to go exactly in this plane of movement this way, and then kind of angle it and all that. Now I just tell patients basically just pull back and go in the plane of movement that feels most natural or comfortable. And so you can kind of see I'm just pulling back like that. And I would do 2 sets of maybe 10 to 15 repetitions, flip over so that I'm palm side up, and I would do the same thing and curl in this direction. You're going to feel that over here. 3 sets of 10 to 15 repetitions. A lot of times if we have inflammation of the tendons that are going through the wrist, or we've strained the muscles either in the flexor mass here or on the extensor mass on the back side, by loading them, putting them under some tension, that helps with the healing process as well as increasing blood flow to the area and desensitizing that area for pain. I hope these tips help, guys, and thanks so much for watching.